There we go. I'll just share my screen. Thanks, Reid. Thanks very much. I'm delighted to be here. I only have, I think, 5 minutes to kind of go through quite a considerable topic, which is the future of health. And listening to Gabrielle there, yeah, I have optimism. That's all I can say. I believe that we have an opportunity for change and positive change, but I also agree we need to look at how do we bring collaborations to the fore. How do we do that ethically as well? This is where I believe the health service can actually leverage their positive image around the world, and also help accelerate that change that we badly need. So let me start by looking to the future and where do we stand in terms of healthcare? Where do we go? The current system, the model that we have in place at the moment, which is flawed, which is under immense stress and pressure at the moment. And that's very much a pathogenic approach, which is based on sickness. And as you see with COVID-19, the stress and the pressure, which has been anticipated for many years. And where is the opportunity, which is around value creation and also changing the mindset? And I think it's important to understand the definition of health from the WHO's perspective as well, and globally what we see health. And health is a state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity. However, if you look at the way that we treat health, it's purely on the basis of disease. So where the real opportunity is in this area here on the right-hand side, which is the health factors. So that's really the focus point and where I'm coming from in terms of our vision, in terms of how we bring the stakeholders together, because health interacts with all of us, all 7 billion on the planet. It's an entry point into any health economy in the world, which is the WISP platform. And let me just show you what that actually looked like. So if we go, I'll go to my next slide, and you will see this is basically when we created this platform, the whole concept was around how do you focus on, shall we say, well-being and health, and then engaging that from the point of view on a global level from the Sustainable Development Goals. So when you see that photograph there, you may just think, well, that's just people out shopping at the weekend. Actually, that would be what I see is your GP practice, which is your local primary care general practitioner at scale, where you can interact with thousands of people and actually promote good health and well-being. And you'll see we actually held this event in Nottingham many years ago, pre-COVID times, where we were prototyping how this methodology and model would work. And it's very much run along the lines of your digital platforms, as you see, which are very much based on intangible assets and are hugely valuable. You can generate lots of ideas. Society is moving very quickly from a service-driven one to an ideas creation one. This is an opportunity in terms of healthcare to generate those ideas and create new value. So this brings massive opportunities. In terms of what we look at from a patient-centered care SDG model and the kind of future of healthcare, which will be around patient-centered care, and alleviating the huge pressures that the health system finds themselves under at the moment. You have the individual, the patient, who needs to embrace and understand how you navigate a health system. You have hospital services, and quite a lot of people want to keep rural hospitals open and that. However, the standard of care wouldn't be up to scratch. It's important people understand what they're actually getting when they go to their hospital. I'm sure Rihanna will know this off by heart. And this is sort of a methodology, a model that we're kind of speaking to lower middle income countries, because they have huge opportunities in terms of their investments going forward. Where do they put their money? They can actually leapfrog where we are at the moment and not make the mistakes that we've made in Europe and in the likes of the States, for example. This is another understanding of how we develop this kind of platform into the community with children starting at an early age, so that you're embracing good health and well-being right across the context from early doors until right up to seniors. So, you have your kids programs in schools. You've got your WIS at work, which is stress management in the workplace. Then you have seniors, which looks at falls prevention, quality of life, and loneliness. Then you look at the community aspect, where you're building trust through all these activities. And at the same time, while all these interactions are going on, you're creating new and meaningful jobs, and you're able to anchor this into an economy which is already existing, which is the health service, which is a $12 trillion market space right across the world. And you're able to tap into good health and well-being in the wellness sector, bridge that gap. You're able to come into the financial sector as well. And I'll explain a bit more as we go through this presentation. It was great to hear, the Grass Network doing the work in terms of the arts. This is a massive opportunity for the arts. And let me just explain what I mean by that. If we can work together and show the value of the arts, and I mean that can be in dementia care, it can be in multiple areas. And why are we, at the moment, we currently have huge problems in terms of staffing and recruitment. Why not invest in our arts? And why not empower local communities, the artists in the local community, move the capital and the revenue that is recurring. Remember, when you have 93,000 vacancies in the NHS, which is recurring, for example, why not use that recurring funding to empower local communities and artists? Why not divert that funding there? And you're creating value for the government as well, giving people jobs, meaningful jobs, which is the most important thing as well. So it can be a huge catalyst. If we do this, as I said, we prototyped this from 2015, 2016, 17, presented this work in 2018 in Geneva, and then was picked up by the UN Director General's Senior Advisor. You're able to demonstrate the value here, that you're creating, like you're improving emotional well-being and resilience in young people. You're decreasing isolation and motivation within the health, social care, medical professionals. So it's a win-win for all parties in the community. The value proposition, as I said, if you put £1 invested into this methodology, you get 36 back in value created. That's societal impact. So there's huge opportunities in this space. Where we go forward, how then do you scale these opportunities? This really comes down to the Sustainable Development Goals, the opportunities in partnerships, the work we've been doing with the Vatican Commission, the partners with the Interparliamentary Union, UN Habitat, UN Academic, SDG Cities. And you need to be able to scale this by working collectively and bring the financial investments behind it. You can only do that in partnership. You can't do this on your own. So that's very important. That's what we're doing at the moment. We have had a very, the Global Social Prescribing Alliance, which is an area that we're working with the National Academy of Social Prescribing. It was launched by the UK Health and Social Care Minister last year. And this really is looking at the community. How do we refer patients and clients and consumers of healthcare in the community through the health system? How do you alleviate the pressure on the health system through community activities? And we've produced a number of publications in our first year. We're now into our second year. We want to onboard about 20 member states. This is the Global Social Prescribing Alliance. What we then eventually can do as well is look at how do we finance the projects in terms of investment vehicles. So that's kind of our work with the Global Social Prescribing Alliance. These are some of the publications that we've published in terms of working with the students. We have an international student movement framework. We've published a playbook. These are all free to download. You can check it out at the globalsocialprescribingalliance.com. And this gives us an opportunity to start afresh with the next generation of medical students and bring forward this ideology that prevention is better than cure, as we spoke about before. Now, moving forward, how, again, working with the SDG cities and the global initiative. So hopefully everyone is familiar with the SDGs. Which were, embedded, shall we say, as a compass for the world in 2015. 193 heads of state stood up and said, this is the roadmap, 2030 agenda. I don't think we have the time till 2050. We need to get our skates on. And really what we're trying to do is bring these city partners in terms of mayors, government agencies together and bring these new ways of thinking together collectively. Get results, start meaningful action in certain cities, and then scale them once they work. This then brings us into the World Urban Forum. Our plan is to kind of scale this to 1,000 cities over the next few years, and then develop those results further across the patch. You can see the work that we're doing with the Vatican Commission, EU, UN Habitat, and various other partners. Absolutely crucial that you work with trusted partners. So how do you finance all this? This is where we go in terms of financing. So we have been working on an SCR 500, which is an index, which is part of the UN GSII's mandate, which is basically to look at a fund, investing in a fund that is to deliver the SDGs. The index is now 5 years on. It looks at the top 500 stock listed companies. And the returns, the cumulative return over 5 years is 65%. The 2021 report will be out. So we're currently engaged with the investors in terms of putting money into the fund, which then we can use to finance the new unicorns that we identify for health and well-being. So we have created our first fund for SDG3, which is a Brasov fund. So we want to support Brasov, Kinshasa, San Marino, Sikkim, and Mendoza. These are the cities we've identified for that fund. And then we can invest in health and well-being programs. And this includes the arts, cancer services, looking at generic drugs, and so on and so forth. Looking forward in terms of the opportunities, and if we look at how do we bring all these parts together in terms of healthcare and the future of healthcare, you will have seen, there's a huge market space out here. How do you bridge this gap between big pharma, diagnostic companies, vaccine manufacturers? You see there's a huge need. Even the inequalities that we see at the moment with the vaccine, it's huge. We need to be able to bring these partners together. One of the key aspects of the WIS is it gives you an entry point and an opportunity to actually bridge those gaps, bring those market players into play so that you can actually deliver that value in the communities. In terms of investment, if you can see here, this is the investment and innovation in terms of what's happening in the startup community. You can see the huge amount of numbers being invested in unicorns at the moment because they're really looking for solutions. However, there is a challenge here because, a lot of these companies and corporations in the tech industry, they don't understand what the healthcare industry is about. We talked about ethics earlier, which is crucial. You have to have the right values in this sector because if you don't, a lot of people get injured or hurt or unfortunately die. In terms of where we have had in the past, the reason why we need to make this positive change, and you'll see this is the European One Health Conference in Bucharest in 2019, and we kind of had predicted for many years that this pandemic was on the way, and also the challenges that the healthcare system faces. This is pre-pandemic, and you look at the staff shortages that we face by 2030, 18 million. This is pre-pandemic. The cost and spend within the health sector is over $8.7 trillion in 2018. The global population is growing, the number of people over the age of 60, and the world is ill-equipped. And we've seen that from the pandemic. It's really hammered that home that we weren't prepared. But that gives us an opportunity to build back better and actually embrace the positive change that can come. There will be a lot of bumps on the way. The next few years are going to be rocky. There's no doubt about that. The reason it's going to be rocky is elective surgeries worldwide have been absolutely decimated. And just wanted to give you an understanding of where we stand at this moment and the real challenges coming ahead for the health system. You can see 28.4 million elective surgeries last year were delayed. Whatever happens, that will have a knock-on effect in terms of mortality rates. So you're going to see, unfortunately, people will die. Those waiting for elective surgeries, unfortunately, will pass. That's it. These are the challenges that we face. Healthcare workers have been decimated through this pandemic. 115,000, a minimum of 115,000 health workers have died from COVID-19. And we are seeing about 500,000 US healthcare workers have left in the past year. Now, this was pre-pandemic. As I mentioned, the 18 million staff that we were short. And you'll see the other statistics here that I have in terms of the malpractice, the patient-centered care, the impact of in low and middle income countries, the deaths that happen from malpractice in terms of poor care, 2.6 million deaths a year. The dementia increases that we face. These are just some of the costs and some of the consequences of what's happening and where we go in the future, which doesn't look very good if you look at where we're at the moment. But I wanted to then move forward in terms of, where do we go after this? And we can't do the same thing over and over again. We need to make change. This can only be done collectively. You talked about the political will. Absolutely. You need to get that political will, but we also have to take the responsibility to make that change ourselves. This involves a mindset and a change in how we do things. So I hope I've given a bit of an insight into how we're trying to do that, how we're trying to make that positive change. The work that we're doing in terms of the World Health Innovation Summit, we've identified a number of programs, a number of key areas around gender equality, multiskeletal, MSK, shared decision making, working with global thought leaders around the world, trying to leverage this change. We're interacting with multiple stakeholders around the world to try and make that positive change. So I hope I'm giving you an insight into what we are trying to do and work with the likes of the Grasp Network to try and leverage that positive change. What we have to ask is a couple of questions around the future of health, and what type of health system in the future do we want? Do we want health for all? That requires a change in mindset from cost-driven to value creation. What are the opportunities as we move forward from COVID-19? As I said, we can create millions of new jobs in this new and emerging sector. What role will the SDGs play in healthcare? Climate change, for example. These are all interconnected with health and well-being. If we don't have water, you've got no health. How do we co-create? And this is where we bring in different sectors. I think one of the key sectors is the financial sector, bridging into that economy of investment, and showing the value of what we do. That's another area of opportunity. My final slide, I think, is around, how do we get to that point? And really, that's is around intellectual, knowledge-driven wisdom, and navigating. And this is very much about us, me, you, we, us all working collectively to deliver the Sustainable Development Goals. I think without that, we are in big trouble. And this needs a massive mindset shift. So that's me, I think, done. So I hope I'm on time.